We founded Concentric AI about 7 years ago with a singular purpose to make data security easy for enterprises. Back when we started, our focus was unstructured data, whether it's on the cloud like SharePoint, Google Drive Box, or on-prem file servers. The reason was unstructured data is hard to understand. There's all kinds of sensitive files that are beyond PII and regex patterns, like finance reports, IP, business critical data, sensitive HR data, and so on. We leverage AI to automatically identify that kind of sensitive data. Now, in the last couple of years, with the advent of Gen AI, this has become a more critical problem for companies. What has been important is now exacerbated by Gen AI because AI allows employees to search for information and it provides the answers from wherever the information is found, and it's highly critical to secure all the sensitive data appropriately so that the wrong data doesn't fall into the hands of bad actors. Healthcare organizations have to move with the times. They are taking a lot of their data into cloud platforms like Microsoft 365, SharePoint, Google Drive, and others. Now, there are security implications around it. With these cloud platforms, you get productivity advantages and convenience for business continuity, ease of use for employees, but it also brings along risks, especially in terms of how easily documents can be shared, and how difficult it is to have a sense of risk that all your sensitive data poses in the new environment. So you need to have tools that proactively go and take an inventory of all your critical sensitive data assets, being able to identify them and appropriately ensure they are appropriately permissioned with least privilege access principles. The other thing that's really important with these cloud tools is now they're all releasing their own Gen AI assistants, like a Microsoft Copilot that makes it very easy for employees to search for different kinds of information. And it becomes important to have the right permissioning in place so that people who are trying to search for inappropriate information are not able to get their hands on it. Healthcare organizations face a unique challenge compared to some of the other industries. First of all, they hold really sensitive data about patients, patient information, and really sensitive medical data. Now, traditional tools that identify sensitive data rely on identifying set patterns or regular expressions. Now, this can help in finding credit card numbers, your social security numbers, the UK national ID, and so on and so forth. But just imagine the wide variety of really sensitive medical information that you would encounter in a healthcare setting, whether it's prescriptions, whether it's patient admittance forms, whether it's medical history questionnaires, lab reports, symptom explanations. So there is a wide variety of these really sensitive data that's unstructured, and looking for specific patterns or specific drug names or specific disease names and symptoms, it really becomes infeasible to do it in an effective, reliable way. That's where you have to leverage the power of AI, where the AI understands the context of the information in a document and automatically can recognize that something is a lab report or something is a patient history or whether it's a prescription, so that you can reliably identify all such sensitive documents instead of trying to build complex rules to detect specific patterns and disease names and drug names. The new Gen AI tools like ChatGPT, Anthropic, Claude, they are wonderful productivity assists for employees to get their jobs done better, but they introduce an additional layer of risk. Intentionally or unintentionally, people can upload sensitive prompts, and these are going outside your organization's boundary to Anthropic servers or OpenAI servers. Employees can potentially upload very sensitive documents as attachments. So it's a two-step process where first, ideally, you would have proactively gone across all your repositories and labeled your data appropriately. The second part is you have to monitor what employees are doing with these AI assistants and these AI sites. You have to monitor the prompts, you have to monitor the responses, and you have to monitor what is if they're trying to upload anything. And we do that. We provide an ability to not only monitor, but also take action, whether it's redacting sensitive bits in the prompts or blocking prompts or attachments entirely if we deem that to be sensitive.